Radiation can affect the urinary system. Both kidneys can be affected by radiation, direct or indirect. Direct from tumor lysis and hyperuricemia can affect the kidneys and cause renal failure. Direct effect on the kidney is congestion and swelling, impairment of renal function, atrophy of renal tubules, and may return to normal or cause renal failure. Acute effect is acute inflammation during 5 weeks exposure to dose 2,300 rad. There is anemia, cardiomegaly from hypertension or high blood pressure, and the level of hypertension is an indicator for injury of the kidney. There is protein loss in urine and renal failure. They can cause death from cardiomegaly. This situation may end in severe acute inflammation within 2 months of exposure. Chronic effects. Chronic inflammation within 2 months of exposure, which lead to anemia, albuminuria, hypertension, renal dysfunction. Chronic inflammation occurs in 3 to 6 weeks when both kidneys are exposed to dose 2,400 or 3,250 rads. And this can be manifested by hypertension, anemia, renal impairment expressed in laboratory as elevated urea and creatinine, proteinuria in urine. It is finally renal atrophy and tubular necrosis. Also, what is the effect of the renal bladder? Urinary bladder effect is acute effect or chronic. Acute effects as any acute effect on mucous membrane congestion after 3,000 rads, and there is swelling of the mucosa. First red, then become pale. There is decrease in the bladder capacity or bladder size. Exposure more than 3,000 rad. There is reduction of the bladder size from congestion of the mucosa. Pelvis exposed to 6,500 or 7,500. The bladder tolerate this dose, and there is acute inflammation appear at the end of the treatment after 3 weeks of the end of the radiation. What are the manifestations of acute inflammation? Frequency micturition or urination, inflammation of blood capillaries of the mucous membrane, bleeding under the mucosa, uncontrolled urination. How can I treat this acute effect? By antibiotics specific for urinary tract infection, complete comfort, and uroseptic. What are the chronic effects? Fibrosis, narrowing, bladder by endoscope, with dilated tortuous blood vessels and which cause hematuria, is pale color of the mucosa, chronic ulcers, fistula with neighboring organs, calcified deposit and stones with symptoms acute pain, difficult micturition. What are the effects of the ureter? Hydroureter and hydronephrosis from back pressure and fibrosis. Treatment by analgesic that are not nephrotoxic, antibiotic, diuretic, renal dialysis, or even transplantation. Ureters can also be affected, and there is fibrosis, back pressure, stricture, there is bacterial inflammation from obstruction. Thank you.